Hi, this video is on hand sanitation, which is a form of hand hygiene. This should be done before and after any exposure to a patient environment, and should also be done before donning any PPE, as well as during and after doffing PPE. As a side note as well, it needs to be performed with a minimum 60% alcohol-based hand sanitizer to be the most effective, as well as should not be performed when hands are visibly soiled, with procedures involving bodily fluids, and with certain pathogens due to alcohol not being able to kill bacterial spores. Hand washing should be used as an alternative. So, to start off, the hands must be completely dry, as well as there is no jewelry, long sleeves, and if there are long sleeves, they should be rolled up, and there's no artificial gel nails, because all of these things have been shown to increase the microbial count on the hands. So you want to be sure to use enough hand sanitizer, not too much and not too little, and then you want to start rubbing it between your hands. Now this needs to be done for a minimum of 20 seconds at least. You want to make sure to cover all of the surfaces, so this includes the palms, in between the fingers and thumbs themselves, right, the back of the hands. And once the 20 seconds has passed and the hands are 100% dry, no longer wet from the sanitizer, then it's recommended as well to maintain skin integrity that you use lotion after as well. Alcohol-based hand sanitizers should also not be used after washing hands immediately, because this increases the risk of dermatitis. Hi, this is a video on hand washing. Hand washing is part of hand hygiene, which is one of the most important ways and effective ways of preventing the transmission of harmful pathogens, and should be done following all standard precautions as well as any procedures involving bodily fluids, and performed any time that the hands are visibly soiled. So, to start off, the skin on my hands is intact, free of any cuts or scrapes. There's no jewelry or artificial gel nails, as well as the sleeves are rolled up if they are long sleeves. So you want to start using warm water, because too hot of water can increase skin damage as well as get rid of more protective skin oils on your hands than warm water would. So you want to rinse your hands in the sink, apply soap, and you want to scrub for a minimum of 20 seconds, making sure to cover all of the different surfaces of your hands. So this includes the palms, the back of your hands, your thumbs and fingers, in between your fingers, under your fingernails, and your wrists. So once this is done, then you could rinse your hands under the warm water. Use a disposable paper towel to dry, and then you want to use this paper towel to turn off the tap, because the tap is contaminated with whatever was on your hands since you used it to turn it on before your hands were clean. So you want to discard the paper towel and then use lotion afterwards to maintain skin integrity. Hello, so I'll now show how to properly don certain PPE items. So you want to start off with hand hygiene. Now here I'm using hand sanitizer, but if my hands were visibly soiled or felt dirty, then I would wash my hands. And this needs to be done for a minimum of 20 seconds. And the reason for doing this is you don't want to contaminate the sterile items that you're about to put on and take into an environment. Making sure to cover all surfaces. So once hand hygiene is done, then you would start with the gown. So you want to make sure that you have the opening of the gown pointing towards your back. Now if the gown is too small, you might need two. The first one you would put on with the opening pointing towards the front, and then the second one you would put on with the opening pointing towards the back. And the gown is good for contact precautions. So this is to help protect your abdomen, your back from getting exposed. So, and you'd start by tying the first necktie at the top, and then after that one is tied, you would tie the one at the back. And your back should be fully covered once it's done. So once the gown is on, then you would move on to the mask, in which case it's going to be a surgical mask this time. So you would put it on your nose and chin, and then tie the first one over your head. And then once that's done, tie the next one. And what the mask is for is droplet precaution. So this is large particles in the air that could be carrying pathogens. If the particles were smaller, then you would need an N95 mask instead of a surgical mask. And then you just adjust it, making sure that your chin and your face is covered. So once that is done, then the final item would be the gloves. Again, you want to make sure you're grabbing the correct size so that way they don't rip and they're able to do their job properly. And what you want to do here is you want to make sure that the glove extends over top of the cuff of the gown to fully seal it in. And the gloves would again be part of contact precautions. And the gloves, the mask, the gown are all used for reverse isolation precautions as well. So that's when a patient, for whatever reason, is extra susceptible, and it would be to protect them as well as yourself. And now that the gloves are covering the cuffs of the gown, the PPE is properly donned. So, now that we want to take off the PPE without contaminating the environment around us, we have to be careful doing it. So what we do to start is we take our gloved hand and pinch the outside of the opposite hand's glove and pull outward, pulling it inside out. And this is to avoid touching your bare skin with the contaminated glove. And we're taking these off first because they're the most contaminated area that we have. So once the first glove is off, we put it into the other hand, and then we take our bare hand and sneak it under the glove, again pulling outwards. So that way, all of the contaminated product is on the inside, all the contaminated surface is on the inside of these gloves, and then we throw them in the trash. So once the gloves are off, we use hand hygiene again. And this is because the gloves aren't completely effective at keeping your hands sterile. So you want to make sure that you clean your hands, and this is again for a minimum of 20 seconds that you're doing this for. And what we're going to do after hand hygiene is performed is we're going to start with untying the gown. This is the second most contaminated area. And now that our hands are freshly cleaned, we want to use the freshly cleaned area for around our face, since that's the most sensitive. So you want to start by untying the neck portion of the gown. First, and then after the neck is done, untie the waist. Now, you have to be very careful pulling the gown off of you because you don't want to touch the contaminated area. So you grab from inside the gown and you pull outwards. So that way the contaminated product does not spill onto you. And then you roll this up while it's inside out and either put it into the proper receptacle for cleaning, or if it's disposable, throw it out. After touching the contaminated gown with your bare hands, you want to again use hand hygiene. And then after your hands are clean again, you want to undo the face mask. So if I had separate goggles, I would start with those and put those into the correct bin for cleaning. But since this is a one-piece face mask, you start by untying the bottom portion of the face mask first, being careful not to touch the front of the mask because that's still contaminated. And then once the bottom is untied, then you move forward to the top, lean forward, and then pull away, throwing it into the trash. Now, once all of that is taken care of, you perform hand hygiene again. Moving on to a new area. And then once hand hygiene has been properly performed after and all your PPE gear has been removed, you are now done doffing your PPE.